right. I just want to use this segment to reach out to physicians, social workers, discharge planners who are in the decision making of where to refer patients. We would love to work with you. We are small home care agencies. I am a physical therapist and I run those agencies clinically. And we have really great team. We train them. We competency them. We have insurance that covers their practices, and we train them on a regular basis. So we will be happy to work with you to achieve your goals of what your facility is looking for in a home care agency.
We're looking for social workers or doctors, MAs, nurses, because majority of the time they're the ones who have that conversation with the patient who is completely unaware of what home care actually entails.
Right.
And might be a little intimidated by
absolutely.
that concept.
Yeah.
But I know that they want something that makes it streamlined and consistent, which we all are, and then easily accessible for them as well, because they're running busy schedules all day, dealing with loads and loads of patient needs and trying to juggle that without giving up the care that these patients need. So being able to be consistent, I think, is the biggest thing. You get the same nurse, the same therapists. The patient is going to see those same people each visit, which is so important because they're in such a vulnerable state as it is, that they don't want someone who they don't know coming on the second visit, because they've already started to create a relationship with that first person on the first visit.
I think like Valor and Mahmoud have touched on, the continuum of care is really big. I know that people like to work with us because when we say we're small, we have plenty of services. In fact, we have quite a few that not everyone has, like the lymphedema, the speech pathology, the social worker, but most importantly, they know who's coming to their home. They don't have somebody, if you have a wound or you've got a major issue, the last thing you need is 5 different people who you have to start over every time they come to your house on what's going on. So you develop that rapport. You can see if they're improving or not. You can develop that relationship with their primary physician. And I think as well, after hours, if somebody has a question, they can directly contact Mahmoud. And you're not calling an 800 number and being on hold and everything. And I just think getting out timely, that's a huge thing. If a patient needs care, I don't know about you, Val, and Grand Rapids, but usually our patients sometimes are already home. And so they needed care a week ago. So the last thing they need is to wait another week and have that wound or the lymphedema get worse or whatever their condition is. So I know that people are complimentary of our services in that way. We also will come and meet that patient and develop that trust, because I think the generation typically that we're dealing with are private. They don't want you at their house, disturbing them. And so we do try to be respectful of, their needs and their schedule and work with them. If they're not a morning person, we try not to show up at 6 in the morning. But I just caring about people and treating them like we would our own family, I think is the difference between us and some big company that their goal is to be the biggest national company. Our goal is to take care of every patient individually.
And I'm here to say also, if we have a patient concern, we're really quick to jump on it and address it. We don't let these things simmer or get out of hand. So our managers are really great at addressing things that need to be addressed timely and efficiently to the patient's liking and to the referral source's liking. So we take our business seriously, and we want to reach out to you to let you know that you got a partner here in delivering home health care, and would love to work with you.